Hello everyone, I am Dr. Ramya Bandi, Pediatric Neurologist at Ankura Hospitals, Hyderabad. Today we are going to talk about EEG. So EEG stands for Electroencephalogram. You all might have heard about ECG, which is done for heart. Basically in ECG what we check is the electrical activity of the heart. So similarly in EEG we check the electrical activity of the brain, which tells about the functionality of the brain. MRI brain will give us about the structural details, whereas EEG will tell us about the functionality of the brain. Here what we have to remember is the EEG will record only electrical activity which is present at that point. So it's a real time monitoring. So if there is a seizure like a couple of hours ago, it will not record the seizure, but whatever is there, it is recorded. Then you might have a question why it is done if it is not recording the seizure. So generally we do have some telltale signs or signature marks of these seizures which will occur. Generally we do have some telltale signs about this seizure, whatever the seizure activity that has occurred in the past. To know about that and to know about the general functionality of the brain, we do this. So it is not that all the times we do get our answers, but in 50 to 60% of the cases we do get some clues depending on which we can take the next step. So EEG is a very important investigation asked by any neurologist. How it is done, I'll show you how it is done. These days we are recording digital EEGs only. So digital EEG is nothing but from the amplifier the signal will get converted into digital waveforms and it is displayed on the computer screen. So this is how the amplifier looks like, and these are called the leads. So depending on the requirement, the number of reads will vary depending on the age also. This is called the electrode, as you can see. So electrode will have a cup and then this will record the signal. This is dipped in a gel, as you can see the gel is already here, and attached to the baby's brain like this, child's or anybody's, adults like this. This attachment will also have a specific pattern depending on the age of the child. So that is how it is done, and as you have seen there are many leads here, and no child will cooperate with so many leads on the brain. So generally we do a sleep recording to get a clean record of the EEG. Not only that, in sleep whatever changes we wish to see or whatever changes we wish to know about the seizure will appear more in the sleep. So that is why a sleep record is very much required, and at least a minimum period of 20 to 30 minutes is recommended to know how the record is. Unlike ECG where you can just take couple of papers and that's all it is done. But in EEG we do require, as I told you, some time frame to know about the brain activity. EEG is mainly done to know the functionality of the brain. Thank you.